Hello, my name's Samantha, and I am going to be your nurse practitioner student for today. Today we're going to be going over your head, your ears, your eyes, your nose, your mouth, your throat and neck, cardiac and respiratory system today. I'm going to quickly wash my hands, put on the gloves. Okay, can you tell me your name and your date of birth?
Doug DiMattia, 7/14/92.
Okay, patient is alert and oriented ×4. Looking at him, I don't see any discoloration in his skin. There's no visible lesions. His skin is appropriate for his ethnicity. There's no jaundice or cyanosis or any redness anywhere. Now looking at his head is normocephalic. I'm going to be pressing on your scalp. I want you to let me know if anything hurts or you feel any tenderness, okay? That hurt?
Nope.
Okay, now looking at his scalp, I don't notice any abnormalities, no lesions or moles or any palpable masses here. His hair is brown and it is evenly distributed around his scalp. Okay, now moving forward to your face. Your facial features are all symmetric. Your nose is midline. Thank you. We are going to be testing cranial nerve 5 and cranial nerve 7. Cranial nerve 5 is the trigeminal nerve, which is a sensory nerve, and cranial nerve 7 is the facial nerve. Can you raise your eyebrows for me? Perfect. Can you smile? Okay, can you frown? Excellent. This shows that cranial nerve 7 is intact. Can you take your glasses off? Okay, close your eyes. Okay, good. This shows his eyes have good muscle strength, his eyes open to resistance. Now I need you to close your eyes. And let me know when and if you feel anything, okay?
Yes. 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 Yes.
Good. All right, now let me know if this is hot or cold.
Cold. Cold. Cold. Cold. Cold. Cold.
Good. Okay. All right. Now I'm going to be palpating your masseter and temporal muscles. All right. Can you clench your teeth for me? All right. Now open. Close. Perfect. So there was no popping or clicking noises felt or heard. Okay, now onto his eyes. I can tell just by looking at his eyes, they are symmetric with his face. His conjunctiva is pink and moist. His sclera is white. His eyelashes on the top and the bottom are evenly distributed. His eyes, there's no ptosis noted. There's no visual abnormalities. There's no lesions, no masses. There's no irritation or redness around his eyes. There's no drainage or no crustiness. What I want to do next is test his visual acuity with the Snellen eye chart. For this, you can keep your glasses on, and I want you to cover your right eye. Now read the lowest line that you can.
LTFPH.
Okay, now do the same with the other eye.
LTFPH.
Okay, now that shows that he actually has 20/20 vision. Now I am going to actually test his corneal light reflex with my pen light, which is also known as the Hirschberg test. So I just want you to look straight ahead. Okay. The light reflections are symmetric in both eyes, which is a normal finding. Now the next thing that I want to do is I want to test for accommodation. So I want you to just follow your eyes with this pen light. Don't move your head or neck. Okay, just follow it. Perfect. Both of his eyes moved symmetrically. They moved inward with no involuntary movements. Now another thing that I want to test, your extraocular muscles. So I want you to just follow my finger. Again, don't move your head or your neck. Just your eyes. Now this was done using the 6 cardinal signs of gaze. It actually tested his cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear and abducent cranial nerves, and all of his cranial nerves are intact. Now I just want to take a look at his lacrimal apparatus, which is the tear duct system, and let me just take these off. Okay, there's no swelling or obstruction noted around those glands. Another thing that I want to take a look at regarding his eyes are his pupils. So if you can, take your glasses off. Okay, look straight ahead. I'm going to use my pen light and shine a light in your eye. Okay, his pupils are round and equal in size. They constricted to the light briskly, which is a normal finding. Next thing that I'm going to take a look at is his fundus. I'm going to use my ophthalmoscope. Oops. Okay. Again, just look forward. So his red reflex is present. I actually saw his optic disc, which is round with clear, distinct margins. It is creamy yellow in color, which is a normal finding. I also was able to see his retinal arteries, where I didn't see any abnormalities. I didn't see any signs of glaucoma or any hemorrhage, or any cotton wool spots, which is all normal findings. The next thing I'm going to be taking a look at today are his ears. So just by looking at him, I can see that his ears are symmetric and they are equal in size bilaterally. His external ear canals, there are no drainage, no irritation, no redness noted around the ear canal. I am going to palpate his tragus and his pinna. I want you to tell me if anything hurts. Anything hurt?
Nope.
Okay. So moving forward, I will be taking a look at his tympanic membrane, pulling his ear up and back. Ooh. Good. Okay, so the tympanic membrane is a pearly gray. His auditory canal is pink. I do see the cone of light actually at the 5 o'clock view. So now, okay, the next thing that we're going to be doing is a couple of hearing tests. So one of the first hearing tests that we're going to be doing today is called the Weber test. The Weber test is done with a tuning fork, and that is to see the bone conduction. So I am going to place this tuning fork in the center of his head, and he is going to let me know whether or not he hears it equally in both ears or louder in one ear rather than the other. Got it?
Yep. Both.
Equally?
Yes.
Perfect. Okay, that is a normal finding. So the next hearing test that we're going to be doing today is called the Rhine test. The Rhine test tests comparison of air conduction to bone conduction. So I am going to hit my tuning fork and place the stem of the tuning fork onto his mastoid bone, and then about an inch away from his ear, he's going to let me know whether or not he still hears the vibrations. Do you hear it?
Yep.
What about now?
Yep.
Perfect. I would do this bilaterally. I would do this the same exact thing on the left ear as well. Air conduction is typically greater than bone conduction, and that is a normal finding. The next hearing test that we're going to be doing is called the whisper test. So I'm going to stand behind the patient so that they cannot see any lip movements, and I'm going to whisper 3 words, and he is going to repeat those 3 words.
Hat. Bat. Cat.
Okay, so that went excellent. He heard all 3 words appropriately. Okay, so now I'm going to be looking at his nose. Just by looking at him, I see that his nose is smooth, it is symmetric, there is no visual abnormalities, it is the same color as the rest of his face, there's no moles or lesions that I can see. I'm going to start by palpating the bridge of his nose along with the smooth muscle. Does that hurt or any tenderness?
No.
Okay. Next, I will be palpating his sinuses. Can you take your glasses off? I am going to start with the frontal sinuses, which are above his eyebrows. Any pain or tenderness?
No.
Okay. Next are the maxillary sinuses. Any pain or tenderness?
No.
Okay. Next, I will be checking his nasal cavities. So first, I would have him blow his nose to get rid of any boogers. So he blew his nose. Now, if you can, just look up. Okay. Just use this. Okay. So his nasal septum is patent. It is free of any blockages, any deviations. His turbinates are pink. I do want to check for patency, so if you can, just hold your right nostril, breathe in and out. Good. Do the same thing to the left. Okay, so he can breathe bilaterally with no complications. It was easy, it was unlabored. This shows that there are no signs of polyps or blockages or any abnormalities within his nasal cavity. It is patent. Moving forward, I'm going to be taking a look at his mouth. So the first thing I notice is that his lips are symmetric. There are no ulcerations. There is no visible lesions. His oral mucosa is pink and moist. There's no edema or swelling around his lips. I will have you open your mouth. Okay. So there's no ulcerations or any lesions or any sign of trauma on his buccal mucosa. His soft palate is pink. There are no discolorations. There was no foul odor coming from his mouth, no ammonia, no sweet, no bad odor. I do see a couple of fillings, which is fine. He didn't have any missing teeth. Now, one thing I want you to do, I want you to stick your tongue out. Now move it side to side. Now lift it up. Perfect. So his frenulum is intact. It's midline, which is normal. And that just tested his cranial nerve 12, which is intact. He was able to move his tongue side to side, up and down, which is a normal finding. Now stick your tongue out again. And lift it up. Okay, perfect. So I can see the uvula, it raised symmetrically. That's normal. I did see his tonsils bilaterally. They are normal in size. They are not red. There's no white patches, no discoloration, which is a normal sign for his tonsils. So now testing the cranial nerve 1, which is the olfactory cranial nerve. I am going to have you close your eyes and I'm going to put something in front of you and you let me know what you smell.
Lemon.
Perfect. Lemon. Excellent. Another thing that I want to test within the mouth is his gag reflex. So again, if you can just stick out your tongue. Ah. Perfect. So as you can see, the patient gagged. Normal finding. Next thing that I'm going to be testing is cranial nerve 7 and 9, which is the taste. So how I'm going to be doing that is I'm going to take a spice and place it on the 2/3 posterior part of his tongue. So I want you to tell me what you taste. Stick out your tongue.
Salt.
Good job. I'm going to do it again on the other side. Now tell me what you taste.
Sugar.
Good job. Yes. So that shows that cranial nerve 7 and 9 are both intact. Now moving on to his neck area, I am going to have you look up. Okay, so I see that his trachea is midline. There are no deviations to the right or to the left, which is a normal finding. I don't see any enlarged lymph nodes or any abnormalities, any masses, which is all normal findings. I will go ahead and move on to palpate his lymph nodes in the neck area. So I'm going to palpate the periocular, post-auricular, occipital, tonsillar, and submandible and submental. So I'm going to start behind the ear. As I'm doing this, I want you to let me know if you feel any tenderness or pain while I press.
Nope.
Okay, so the lymph nodes are non-palpable, which is a normal finding. So next I am going to be palpating his thyroid. I am going to displace it to the left with my right hand and palpate with my left. I don't feel any abnormalities. There's no nodules or any palpable masses. I'll do the same on the other side, displacing the thyroid with my left hand to the right and palpating with my right hand. Again, no abnormalities or masses palpated. Next, I am going to listen to his thyroid. So I want you to take a deep breath and hold it. Look up. Okay, no bruit was heard. The next thing I will palpate are his carotid arteries, making sure to palpate one at a time. So I'll start with his left. Now his right. All right, I'm going to take a listen to his carotid arteries. Again, hold your breath. Okay, so his pulses are 2+ bilaterally, no bruit was heard, no thrill was felt, which are all normal findings. Moving on to his respiratory system, first we will start with the anterior portion of his chest. By looking at him, I can see that the anterior portion chest is symmetrical, his breathing is unlabored, it is easy, his respiratory rate is normal, along with pattern, his expansion is symmetric. I don't see any signs of use of accessory muscles or any retractions. His skin shows no signs of cyanosis or pallor. Looking at his nail beds, they are pink and dry. I don't see any signs of clubbing noted. His capillary refill is less than 3 seconds, which are all normal findings. I will also be looking at his anterior and posterior diameter as well as his transverse diameter. His AP diameter is less than his transverse diameter, which is a normal finding. I am going to palpate his chest. Again, I want you to let me know if anything hurts. That hurt?
No.
Okay, so I don't feel any crepitus. There is no palpable masses or bulging or any abnormalities. Like he said, there is no tenderness, which is all normal findings. So now I'm going to auscultate his lungs. I am going to start at the apex, which is right below the right clavicle, moving in a Christmas tree pattern. I want you to just take a couple deep breaths. Good. Okay, so all lung sounds are clear. I don't hear any adventitious lung sounds. There's no signs of wheezing, stridor, rhonchi or crackles. Moving to the posterior portion of his chest, again, there are no signs of discoloration, abnormalities, any skin lesions, or anything like that. I am going to palpate down his spine. As I'm palpating, let me know if anything is tender or painful.
Nope.
Okay. His spine is midline. There are no deviations to the right or to the left. I am going to test his expansion by placing my thumbs underneath the 10th rib. So I want you to breathe. Perfect. My hands expanded symmetrically with inhalation and exhalation, which is a normal finding. Now I'm going to check for tactile fremitus. I'm going to feel for vibrations as he says 99.
99. 99. 99.
Perfect. So vibrations were felt in all lung fields, which is a normal finding. Now I'm going to percuss all of his lung fields and listen for resonance. Okay, resonance is heard in all lung fields, which is normal. Now we are going to test for diaphragmatic excursion. So can you take a deep breath and hold it? We are listening for the change in resonance to dullness, which I hear right about here, so I'll mark it. Okay, and now I'm going to go upward. And I notice it right here. Okay, I would do the same on the other side. I am now going to measure and it's about 4 centimeters, which is a normal finding. Now I'm going to listen to the posterior lung sounds. So I just want you to breathe normal. Okay, his posterior lung sounds are clear. There are no adventitious lung sounds. There is no wheezing, stridor, rhonchi, or crackles. I'm going to move on to the cardiac system. I am going to start by listening to his heart sounds. I will start with the aortic valve, which is located on the right side of the second intercostal space. Next is the pulmonic valve, which is located on the left, the second intercostal space. Then moving down to Erb's point, which is located on the third intercostal space of the left side. Moving down to the tricuspid valve, which is located on the fourth intercostal space on the left side. Now moving down to the mitral valve, which is the point of maximal impulse, which is located at the fifth intercostal space on the left side. Okay, so S1 and S2 were all audible. There were no murmurs heard, no extra heart sounds. Now I'm going to be moving on to the aorta, the renal, iliac, and femoral arteries. His aorta is actually located above his umbilicus, right around here, and his renal arteries are right below, parallel next to each other. Then moving down are his iliac arteries and his femoral arteries. I am going to start by inspecting his arteries first. So I would lift up his shirt. I don't see any visual palpations or any abnormalities regarding his arteries. I am going to auscultate his arteries and femoral arteries. Starting with the aorta, moving down to his renal, moving down to his iliac, and now moving down to his femoral. Okay, all arteries were auscultated. No bruit were heard in either arteries. Next, I will palpate them. All arteries were palpated. They were 2+ palpable, which is a normal finding. No thrill was felt. Moving on to his extremities. They are dry, appropriate for color, no cyanosis, again, no mottling showing, no clubbing in his nail beds. Capillary refill again is less than 3 seconds. There's no edema or discoloration noted. I am going to start by assessing his brachial, radial, and ulnar arteries in his arm. His brachial artery is found right right in the crease of his arm, in front of his elbow. So I am palpating that. Moving down to his radial artery, which is right above his thumb, palpating that. And now moving on to his ulnar artery, which is right above his pinky, palpating that. They were all palpated, 2+, which is a normal finding. They are strong, and that is normal. So now moving on to his lower extremities. Can you swing your lens on? Okay, so now, again, his skin is normal for his ethnicity. There is no edema noted, no cyanosis, no mottling, no signs of discoloration. I'm going to start by assessing his popliteal artery, which is right behind his knee. So I am palpating them, which are palpable, 2+ and strong. Move down to his posterior tibial, which are right on the bony prominences of his ankle, which are palpable and 2+, which is again normal. And then moving down to his dorsal pedis, which his dorsal pedis is right above his big toe, which is again normal. They are 2+ and strong. And lastly, now I will be assessing for jugular vein distension. So I am going to have you come sit again at a 45-degree angle. So lean a little bit back. I want you to look up, turn your head to the right. Okay, I don't see any bulging of his jugular vein. I don't see any shadowing, which shows that his jugular vein is not distended, and that is a normal indication. That's it.